Well, Renee, you'll remember that last week the MNA did reach agreements with Essentia for its hospital nurses, but the dispute between the union and Essentia, as you can see behind me, is not over yet.
For quality care.
Union clinic nurses are striking, and as well as the Solvay House nurses and Miller Health Surgery and Superior Clinic as well. We're striking over unfair labor practices committed by Essentia Health.
Nearly 300 clinic nurses and healthcare workers from 6 Essentia facilities are now on strike.
It's actually a little bittersweet because I imagine everybody here would rather be inside working and taking care of patients. That's where our hearts are.
During a press conference, the Minnesota Nurses Association laid out their points of discussion.
I took a $10 an hour pay cut 3.5 years ago to come from the hospital to the clinic.
What we're fighting against is cross-facility floating. Basically, just a nurse is a nurse is a nurse and can be put anywhere. Many of us just want to know that the job we apply for is the job that we get to keep, and that if major aspects of that job change, that we have a say in the change.
MNA is asking to meet Essentia Health at the bargaining table after their tentative agreement that was made with the hospital nurses just a few days prior.
Our hospital nurses, our colleagues, were very excited for them and their tentative agreement with Essentia. We think that's super important and glad for them. And it's time for clinic nurses in their work to be recognized for all the things that they do to take care of patients and for their lives, for chronic conditions, for incidents outside the hospital, and provide care that is ongoing.
Essentia has provided a statement saying that the groups currently on strike have no contracts in place and, in fact, have yet to negotiate their first contract. This as the nurses have agreed to several bargaining dates through July.
Essentia claims that first contracts take 18 months to finalize, but we ask why. Since issuing our strike notice, we have offered to meet every single day, and Essentia has declined every single time. For a year, we've sat across from Essentia at the negotiating table. We formed a union to protect the jobs that we love and to champion ambulatory clinic nursing. Clinic nurses deserve the same respect afforded to hospital nurses.
Those in the picket line say they're advocating not only for themselves, but for patients as well.
We have important issues to tackle. Our hope is that Essentia will stop their ULPs and work together to find solutions that are beneficial to nurses and patients.
And Renee, the ULP strike is set for daily picketing from 7 a.m. to 5:30 p.m. The strike does not have a confirmed end date that we are aware of. Just a little bit ago, Essentia did issue a statement regarding the strike, saying in part, quote, instead of focusing on the issues at each bargaining table, the MNA called all new bargaining units on strike without letting negotiations play out at the table, unquote. Now, we've been following this story since the beginning, and we will keep you folks at home updated as we work to learn more from both sides.
All right, thank you, Alex, for that live report.